Hey everyone, hope you have a good time in this project. And thanks to come in this lecture. My name is Chenyang, coming from China. Currently, I'm a research fellow in optics and photonics research group at University of Nottingham. Today, I'm gonna give a introduction and explanation of pulse oximetry using light waves to analyze the hemoglobin in this presentation. I hope you are enjoying the talk. So let's start. The content includes 4 parts, and the first part is some background information about the hemoglobin. Then a very brief basic knowledge of light wave will be given, which will help you to understand the relationship between hemoglobin and the optic signal. And third part is the introduction of the photoplethysmography, also called PPG, and which is very most important points through the whole pulse oximeter technique. And in the last, we're gonna go to explain the principle of the pulse oximetry and give you some different types of pulse oximeters. Here we go. At the first of beginning, what is hemoglobin? I believe some of you are familiar with it as you are in this medical and physics course. Hemoglobin is a kind of protein which has been found in the red blood cells. It carries oxygen in your body and gives blood its red color. Each red blood cell contains several hundred million hemoglobin molecules. The right hand figure shows the hemoglobin molecule looks like. As the left hand formula shows, each hemoglobin contains 4 hemocytes for carrying oxygen. So in general, the hemoglobin can be saturated with oxygen molecules. In this situation, we call it oxyhemoglobin. On the other hand, as a formula, it is reversible. You can see when it desaturated with oxygen molecules, we call it deoxyhemoglobin. And based on above evidence, you would know the hemoglobin is very important for human life. The hemoglobin level varies by age and sex. Normally, men have slightly higher levels than women. Here are the normal range for adult male and female. And the abnormal hemoglobin levels can cause serious symptoms. Can include the fatigue, as the body is in a lower oxygen situation, or the rapid heart rate. The hardworking heart would try to maintain the oxygen level by beating more frequently and to try to maintain the oxygen of the whole body in the blood cells. Also, some relevant symptoms like headache and chest pain will be in a low abnormal hemoglobin symptoms. Normally, lower hemoglobin is called anemia, which can be caused by anything that interferes. For example, the blood loss from the surgery. That's all for the hemoglobin. And here we're gonna go to some basic information about the light wave to help you understand the relationship between the hemoglobin and light. In physics, the terms light may refer more broadly to the electromagnetic radiation of any wavelength, whether visible or not. As the left-hand figure, you see that the prism, a prism dispensing a beam from of the white light, and after that you will see the red light wave at a higher wavelengths, and the blue light wave at a lower wavelengths separated. As you can see, the right hand figure, the visible light which can be seen by human eyes is usually defined as having wavelengths in the range of 400 to 700 nanometers, between and that between the infrared and the ultraviolet. And then here is a good example for understanding of the absorption spectra. Here we got a white beam source. The beam source emitting the light of multiple wavelengths, and it's focused on this sample. And after striking the sample, photons that match the energy gap of the molecules are absorbed in order to excite the molecular, and green light in this example, and other photons just transmitted unaffected. Then if a radiation is in the visible range, 400 to 700. The sample color is the complementary color of the absorbed light. So by comparing the attenuation of the transmitted light, like this black trace, and a absorption spectrum can be obtained here, like this red dot trace. You will see a peak here, which means the green located on the green wavelengths. Due to the, let's go to the hemoglobin. Here, this picture shows the optic absorption of the hemoglobin. Due to the difference in oxygen content, the hemoglobin and the deoxyhemoglobin has different optic absorption spectra, as the figure shows. The red line, pink line shows oxyhemoglobin. Deoxyhemoglobin, and the blue trace is oxyhemoglobin. And as you can see, the two spectrum are quite different at several wavelengths. So this property enables the non-invasive assessment of oxygen saturation. We call it SpO2 measurement in the blood. Yeah, here I'm gonna introduce the key of the oximetry, the Photoplethysmography. It's a PPG signal. Here is a definition. PPG is an optical technique used to detect the volumetric changes in blood. It is a non-invasive method that makes measurements at the surface of the skin or tissue. It could be in the chin or in the ear or somewhere in the body. And the technical provides valuable information relating to our cardiovascular system. So, and here you can see there is an example of how it looks like of the PPG signal. Yeah, let's go. Here's some principle of that. So normally, if we got a light source and a relevant photodiode, and we could have a chance to acquire the PPG signal from finger. That's quite simple. As the top left figure shows here, shine light into the tissue use one or more LEDs and measurement attenuation using the photodiode. These are the just near to the LED. That is the transmission mode. Here is the reflection mode. At the hard pumps, more or less, the light is absorbed. During the systolic phase, the heart muscles are contracted, more blood is present, and the light level is reduced. And during the diastolic phase, excuse me, less blood is present, and the light level is higher. Then you will see a periodic signal captured from the photodetector or photodiode represent the two phase. And the right-hand figure shows a light absorptions from the light source to the receiver. Here is a photodetector, photodiode, and the resultant PPG waveform, which represents a periodic signal. When the light from the LED is incident on the living tissue, it is mainly absorbed by tissue or the another both steady blood volume of both artery and venous blood. And the waveform consists of DC components and the AC components. As you can see here, from the top to the this line, the AC components corresponding to the average of blood volume of both artery and venous blood. And here you got posterior periodic signal. Signal change, that is AC components. The AC components refers to changes in the blood volume during the systole and the diastole phase. Changes in the blood volume can be used to calculate the average heart rate, which is one of the major applications of PPG, among others, as mentioned above. And here is a practical application of PPG. The heart rate monitoring usually carried out in green wavelength range here. As the contrast is higher, so the AC signal is larger, so it is easy to capture the heart rate. And it is this is an approach used in the commercial heart rate monitors. For example, some commercial company like Fitbit or Apple Watch. If you have those devices, you can see this. They got definitely is a green light. All right. Based on above knowledge, we are now going to the last part is the post oximetry. Yeah, first of all, the definition. The post oximetry is a non-invasive method allowing the monitoring of the oxygen saturation of the patient's hemoglobin. The pulse oximeter is a medical device that monitors the oxygen saturation of the patient's blood and changes in the blood volume is measured skin or tissue. And this technique used to monitor the oxygen saturation of hemoglobin at present. The usual technique is isolate the light absorption by artery blood is based on the PPG. So the PPG signal, as mentioned in previous slides, it's originates from the artery blood volume increase during systole, so that the measurement of the PPG signal is in several wavelengths enable assessment of the SpO2. As mentioned in the PPG slides, here is the PPG signals trace. The BL is baseline measurement and taking at diastole phase, often called DC component, and AM is amplitude of the PPG. Difference between diastole and systole, also often called the AC components. So normally the DC is much greater than AC. Normally it's 100 times. So in short, the ratio of AC and the DC is calculated from the amplitude of the PPG signal and from the baseline. And the value does not depend on the intensity of the emulating light. For each wavelength, the AC, DC is proportional to three factors. The first one is maximal artery blood volume increase during systole, and the second is the extinction coefficient of blood component at that wavelength. And third one is optical pathway, path length in the tissue for that particular wavelength. Therefore, in this absorption spectrum, you will see that, just give the example, for example, in red and infrared light range, the oxyhemoglobin absorbs more infrared light than the red light, while the deoxyhemoglobin absorbs more red light than the infrared light. So based on this, the pulse oximeter works out the oxygen saturation by comparing how much red light and the infrared light is absorbed by the blood. And that's the principle base behind of the pulse oximeter. And the next step is make a measurement at two wavelengths. The lambda 1, the lambda 2 are defined as a terms of R. The R ratio is a ratio of ratios. So the ratio of AC and DC at two wavelengths. So it depends on the amount of oxygen hemoglobin and the deoxyhemoglobin present. The ratio between the amount of absorption in two wavelengths changes. So therefore, this ratio is relating to the oxygen saturation, the SpO2 value. So we got a income questions. So which two wavelengths should we use? So normally, normally the manufacturers choose red and near infrared as this gives a bigger difference in signals. But you still can choose different wavelengths, and that's good research area. And nowadays, some researchers trying to use the multiple wavelengths to calculate the SpO2. And the relationship between the SpO2 value and the R ratio is called R curve. So which should involves taking blood samples and measure the oxygen using some gold standard method. Then relating those value to the R ratio, you're gonna got your R curve. So depends on the instrumentation configuration. There is a empirical equation for addressing the R curve. For example, the most usually used in the market is this equation. So in and in the critical care application, the accuracy within 2% is okay for the surgery. Based on the principle, we can make our own pulse oximeter by choosing proper light sources and the photo detectors. The photodiode must be able to receive the relevant light at that specific wavelength. For example, the red signals at around 600 nanometers, and the infrared. Someone use 940, someone use 880. Then we just need to do some further experiment to assemble those two components to acquire the good quality of PVG signals. And then doing a lot of the data analysis afterwards, and you will got your pulse oximeter. Yeah, this slide gonna give you some types of pulse oximeter. One type is of the commercial pulse oximeter is desktop unit, which are quite expensive, and those kind of pulse oximeter are usually used in the hospital. Also, we can find there are lots of finger mode pulse oximeters in Amazon and in eBay. And they are all cheaper than the desktop one. So now I leave a question for you. If you are interested in, you can just search it out offline. So the question is why there's so big difference in between. So yeah, that's very interesting question if you search it. And here get some example of usage of the pulse oximeter. It is usually used during the surgical producing procedure under a general anesthesis or under conscious station. Also, or after surgery during the recovery phase, or in the ICU for the continuous monitoring of our oxygen level. Currently, the NHS clinics provide oximeters to patients who have been diagnosed with COVID positive. They should call or go to the hospital when we got a unusual SpO2 value from the pulse oximeter NHS given. So it's quite useful for the self-monitoring. Yeah, or we can make some fun with our own pulse oximeter, try to measure our own SpO2 value. Yes, that's all the content about this talk. Thank you.